Hello, hello. My name is Donovan. I am a hack nursing student, and today I'm going to be doing a sterile dressing. First, I'd like to state my first five, which would be perform hand hygiene, identify the patient, check allergies, provide privacy for the patient, and then educate the patient on what I'm going to be doing. So, I would first do my DOF nap. I would check the diagnosis, which would be, in this case, an incisional wound. And I'll move the camera at times to show you the patient and all my materials here. But I just want to get this out of the way first. Um, so I would discuss my diagnosis, my orders to change the dressing, the notes from the last nurse, the patient allergies, for example, for alcohol or iodine. And then I would follow protocol of wherever I'm working. Then I would go in and I would identify and introduce myself. I would explain what I'm doing as the nurse. In this case, it would be changing their dressing wherever it would be. Then again, I would confirm allergies. I would lift, I would lock the bed, I would elevate, and then I would sanitize my hands. So from this point, I would come over to my patient. Now I'm going to move things around. I'm kind of working with a small space here. But my patient here with the dressing, I would look at the date and time of the last note, and I would assess the outside to see if there's any saturation and make sure it's intact. Then I would remove the dressing at this point. So I would peel the corners till it's loose. It's pretty loose there. And now, when I pull this, I am going to pull it away from the patient's face. And in this case, the patient's face is right here. So when I pick this up, it's going to be away from the patient. So that way, everything on here the patient can't see it. So I'm going to pull up away, and I'm going to assess what I find on my dressing, which would be the coca, which would be color, odor, consistency, and amount. In this case, I don't notice an odor. I'm seeing mildly saturated serosanguinous fluid, but not really anything else. So now I'm going to dispose, and I'm going to pretend my dispense is next to me, and I'm going to drop. So after I assess the dressing itself, I'm going to assess the wound. And I'm going to be looking for redness, edema, ecchymosis, and approximation. So it looks well approximated. It looks like it is pulled together from the surgery well. I'm noticing mild redness, but nothing really that would concern me. I don't notice any discoloration or ecchymosis, and I don't notice any swelling to the area, so it seems like it's doing well. So at this point, I'm going to move my patient here, and I'm going to show you my supplies I have. So I have alcohol swabs, I have my 2 gauze, my abdominal pad, and then at the end of this I have my sterile dressing. And again, my patient's head is facing this way. So from this point here, I would get my alcohol swabs ready. So how you do that is, when this is attached, I would peel one side, and then pull. And now these would be sterile, and I would take the package and I would just push them up, just so it'd be a little bit easier to grab them. So from here, I'm going to hold this, and I'm going to take my tape. Now this tape is difficult to rip, so I'm going to try to do it on the first time. Okay. So then we have that, and I'm going to attach this, if I can move here, to the table or the counter, wherever you're working with, and fasten it so it's sticking up like so. So yeah, I just kind of taped it to the edge, hanging out. Okay, so from here, I would open my materials, which in this case would be gauze and an abdominal pad, and then I would move to my sterile gauze, but I'm going to open these first. So in these packings, I have the waterproof side down, just in case, to prevent moisture from leaking in. I'm going to take my fingers right on the very edge because I only have this tiny little border here that's sterile. So I'm going to take my fingers and I'm going to do the ballerina arm and open this, making sure my elbow isn't crossing or nothing is crossing over that field. And I'm also remembering my helicopter principle, which is why I have to keep this flat, because nothing can hover over the dressing. I'm going to do the same thing with the abdominal pad. I'm going to grab where it's sterile. I'm going to do the ballerina arm. I'm going to pull out and make sure this doesn't cross back over, and I can't, this is the helicopter, I can't have anything over this here. So from here, I'm going to don my sterile gloves. Now I'm just going to move this again because I have limited space, and these would be my sterile gloves. So I'm just going to move here, open, this, and I'm also going to, let me do that again, and I'm going to try to get my corners here following my margin and straighten these out here. I'm not crossing over my sterile border I have. Okay, so we have this open. So now I'm going to get under the glove here. No, I'm sorry, that was incorrect. I'm going to grab the outside like this, and then like so. And I have this here, and I'm still on the outside. I'm just going to pull this as far down my arm as I can. Now for this step, I'm going to want to hook here, touching, and I'm going to turn this. I found this to be a little bit easier. Turn this so it kind of increases my length of the sterile field, and I'm going to pick this up, and I'm just going to try to get my hand in here. And now that's on, and I'm going to try to get them as far down my wrist as I possibly can. And I have to keep these above my waistline. Now, I know this is breaking sterility, but for the sake of my space issues, I'm going to move this, and I'm going to move my patient here so I can give a view. Okay, if you can see the incision there. Okay, so first here, I have my patient, I have my sterile gloves. Now I'm going to cleanse the wound. I'm going to take a gauze or a swab, iodine or alcohol, and the first thing I'm going to do is I'm going to go down the middle, and I'm going to go all the way down the length of the cut, spinning, and then I'm going to go outside and drop into my waste dispenser. And that's the first swab. Then I'm going to take my second swab and do the outside of the wound. Now I'm making sure that I am not crossing my sterile field, that my gloves are still covering enough to where I don't have to go around to do this. I can just go right here because I have the room. So I'm going to go to the outside, and I'm going to do the same thing. I'm going to go around as I'm twisting the swab down the wound. I'm going to go outside my sterile field, and I'm going to drop into the dispenser. I'm going to take my final swab, and I'm going to do the closest to me. I'm going to roll down the wound as I'm spinning the gauze. Again, I'm going to go outside of my sterile field to drop, dispense. Then I'm going to take my gauze, sterile touching sterile, and I have my two gauze here, and I'm going to drop them on the wound, trying to cover the majority of it. And then from this point, I'm going to take my abdominal pad with the blue stripe facing up, and I'm going to have this stripe aligned with the wound. So I'm going to have this here, and now I'm going to place this on top. And after this, I'm going to touch around because the sterile part is already done. So this is set. I'm going to take off my sterile gloves. And now I'm going to secure the dressing. So when I pull out my tape, and I'm just going to leave this down here. I'm going to move this just so it's more comfortable. I'm going to approximate the length, and I'm going to rip off the appropriate amount and secure. And for this, I wanted to mention you probably want to wear gloves depending on what you're dealing with, for sure. So I'm going to go around the window pane method. I'm going to go bottom, side, top, other side. So again, I'm going to approximate, tear, secure, approximate, go. This tape is very hard to rip. And secure. Lastly, the final. And then, after I'm done securing the dressing, I'm going to label it. So I'm going to tear off another little piece of tape. I'm going to put it in the corner here. And with my pen, I'm going to write my initials, the date, and the time. So that would be a sterile dressing. When I would be done, I would record, report, and restore the room. Or I would record and report my findings, obviously. And I would document all my findings. And so that would be a sterile dressing. Following the video, I do have a submission of my written documentation that I am going to submit along with the video. Thank you so much.